Joining me now via Skype to talk more on this is the Executive Director, Paradigm Leadership Support Initiative, Olusegun Elemo. Segun, it's good to have you join me this morning. A lot of Nigerians, I know you would also have heard a lot of complaints and talk about how the monies were coming in and how concerned Nigerians are relating to the utilization of these funds. Thanks to all those who are donating, and even more money is coming in from the reports we are getting. But do you have concerns regarding the way the monies will be disbursed from our antecedents?
Yes, certainly. I do have concern. As we speak today, there's a huge trust deficit in the country. The kind of governance process that we're running is not giving room for citizens to have confidence in those who are managing the affairs of government. So there is trust deficit in that regard. I must say at this point that even though there are isolated cases, but as a country at large, if you assess the current situation, we haven't shown leadership as much. So the funds coming in now, as at yesterday, I understand that the funds have now reached 19.4 billion naira. That's the private sector donation, and of course, you know, the federal government has now established, of course, as approved by the president, to establish an intervention fund of about 500 billion. Of which funds will be coming in from International Monetary Fund, World Bank, and the African Development Bank. And all of those monies, some of them are grants, but most of them are loans. So we want a situation where the funds, the management process is clear to everybody, all citizens, and with no exclusion whatsoever. And that's why we gave the press release a few days ago, asking the chairman of the Presidential Task Force, who is the secretary to the government of the Federation, Mr. Boss Mustafa, to make the strategy paper for managing the COVID-19 fund, both the private sector donation as well as the intervention fund established by the federal government, to make the strategy paper, open and public to everybody, such that accountability institutions will then know how to come in ensuring accountability of the management of the funds.
All right. Now, the Minister of Finance had announced in a press briefing on Monday, earlier in the week, that about 5 accounts or so have been opened in different banks where this monies will be lodged. Now, she also made reference to the issue of the fact that it is connected to TSA, where it is centrally monitored. Talk to us about how these things certainly would work and how Nigerians will also follow.
No, certainly, if she says that the accounts that the monies will be domiciled are already active and those accounts are connected to the TSA, yes, we expect that there will be no transfer from such accounts without trace. Yes, there will be trace, but of course, you know that we're in an emergency right now. As such, the kind of procurement process that all of these expenditures will follow might not be the regular and the routine procurement process. Even where there was no emergency, you know that ministry departments and agencies do flout procurement laws and financial regulations, talk less of when we are in an emergency. But the fact that we're in an emergency does not mean that people should just go ahead and make expenditure without recourse to the relevant laws and regulations. And where those laws do imply, we expect that MDAs will adhere to existing regulations, even though they need to make emergency procurement. Aside from that, is the fact that the management process, the strategy paper, the framework is not clear as to what we are going to be disbursing to, how we are going to be disbursing, who is authorizing disbursement, and how do we ensure accountability. For instance, when Ebola broke out in 2014, countries like Sierra Leone had ongoing audits of how the funds were being utilized. And as such, they were able to ensure that the funds were utilized efficiently and effectively. You recall that even in Nigeria here, we had issues around how Ebola funds were utilized. So we don't want that kind of situation to occur again with this pandemic. Even as we're fighting the pandemic, we must ensure that the resources available to fight, the pandemic war is efficiently utilized. And for me personally, I would have loved a situation where the private donors, actually, buy items, purchase items that are required, for the frontline health workers to do the work they need to do. But certainly, you do not expect all of these private donors to then, go into the open market and start purchasing. Some of them would prefer, to make financial donations, and there's no crime about that.
Basically, when it comes to the issue of available data, we know that we have always talked about the inadequate availability of data as to what is really on ground, how many people are we really planning for, and so on. Now, if we narrow it down to the issue of COVID-19, some medical practitioners have even said that there is the likelihood of some persons having COVID-19 and not reporting. So we could have even more cases that are not on the radar. Now, how will the inadequate data challenge the utilization of these funds that are being donated or contributed towards this pandemic?
Yes, the problem we're going to have is that we're not going to be able to tell exactly the number of people we're planning for. In the last couple of weeks, we've requested that NCDC provide us the number of tests that they're carrying out on a daily basis and show us the demography of these people, so as to be able to tell exactly the kind of the size of the challenge that we are dealing with. But unfortunately, we haven't had much of that regular update from NCDC. What is going to happen now is that because we don't have this information, we really cannot tell. So what you see happening right now from state to state is that governors are just trying to make provision for likely situation that may occur. For instance, in Lagos State, you see isolation centers springing up here and there, but they really cannot. And of course, those isolation centers are coming in numbers, but they really do not capture whether we're planning for this amount of people and whether this infrastructure, these facilities can cater for this number of people. Also, the issue about ventilators, as you know, there are very limited ventilators in Nigeria. I understand that the federal government is entering into a partnership with Innocent Motors to produce ventilators. But the problem that will throw up for us is that if we begin to have the kind of communal spread that the Minister of Health had mentioned earlier, whether the current infrastructure, the health facilities that we have will be able to cater for that. And that's what we've been, we've always said, those of us in the development space, that we should not wait for the time of emergency like this to be able to make provision for situations such as the one throwing itself into our face right now.
All right. When it comes to the transparency that Nigerians have concern over, what will be an ideal situation in the disbursement, in the trust building and all of that for Nigerians to know, oh yes, these monies were actually used in the way that we're supposed to?
It's not rocket science. It's not rocket science. I am happy that you mentioned ideal situation. Nigeria is not an ideal. It's not an ideal country. I mean, let us be frank with ourselves. Look at how this issue about the social investment program is going on right now. The conditional cash transfer. Even when we say cash transfer, does that mean that we should start doling out cash to people? Does that mean we're trying to curb? We're trying to fight a virus that is likely to spread via transfer of cash. And then now we have the federal government itself, going about handling cash to people. So you've seen, the parliament coming to say they do not agree with that strategy. Certainly, I personally do not agree with that strategy. Even when we say this is a conditional cash transfer program, yes, cash transfer can be done by bank transfer. And if you have paid cash transfer to a number of people for many months, and you have not been able to bank them, then you have a problem. So if you say, for instance, this category of beneficiaries do not have bank accounts, I mean, how can you even say that they do not have bank accounts? If they have been collecting cash for how many months now from the federal government through this program, and then you have refused, intentionally to bank them, to be able to make the process transparent and provide accountability mechanism, then there's a problem somewhere, and that's what has given rise to trust deficit over the years. People do not trust their government, and when they do not trust government, they cannot support government. And the challenge we're going to have is that the kind of support that government is requesting from citizens to fight this coronavirus, they might likely not get it, because you're already seeing people in Lagos, in other parts of the country, flouting, orders and just going about their duties. And what that will do is that we are going to have a situation where we'd rather have cooperation of citizens. If government wants to have adequate and maximum cooperation from citizens, then they must, be ready to also be transparent and accountable in their dealings as well.
All right, we have to leave it here now. Olusegun Elemo, thank you very much for talking to us. Right. 19 is a pandemic that the world is trying to wriggle over and trying to keep afloat. How do you think this is going to change the way we do things, the way we interact, or the way we do business, or the way things will go on living from here?
Yeah, certainly. Of course, as you know, it's a global challenge, and then it's going to affect how businesses are carried out, and the effect is going to come in different forms. For instance, the economic impact from the economic angle. You see countries currently struggling, to stabilize the economy. As you know, many countries are shutting down their economies, and they're losing so much in that regard. And Nigeria is not exempted, from that. For instance, if the cost of shutting down the entire, Lagos, Abuja, and Ogun State, a total lockdown, of course, is there. And then, countries as they come out from this pandemic will struggle to revive their economies. Also, countries who depend solely on sale of crude, just like Nigeria, will also begin to continue to experience the negative effect of COVID-19 over even after a period of time before there is stability in the market. As you're aware, I think OPEC is having a meeting perhaps today or tomorrow to see how they can intervene in the global oil price that crashed a few weeks ago, and then bringing in countries like Russia and China to see. Russia and Saudi Arabia to see how much of intervention they can have for them to cut in, the barrels of crude they're producing on a daily basis. So certainly there is the impact, and then from business to business also there will be some changes as to how businesses relate to business or how businesses relate to customers. There will be changes in that regard. Most of the businesses now are changing, operational dynamics, and some of them are beginning to see the impact of COVID-19 and exploring other ways by which they can effectively carry out their business. So certainly,
all right.